Good afternoon, everybody. Thank you for coming along today. I want to give just a brief update of the position in Scotland, some announcements out of the COBRA meeting that has just concluded, and some further matters specific to Scotland that I want to cover. And then, of course, I, the Chief Medical Officer and the Cabinet Secretary, will be happy to answer whatever questions you have. Can I just firstly reiterate the contents of the daily update that was published at 2 o'clock. As of today, we have reported 60 confirmed cases of COVID-19. That is, as I indicated in Parliament earlier, that it would be a sharp spike in cases from the number announced yesterday, which was 36. We have said consistently now for the last couple of weeks that we have been expecting to see cases rise, and that will continue to be the case. The other significant factor from today's update, though, is that we have evidence in a further 2 cases of community transmission, and that is clearly significant in some of what I'm coming on to talk about around the decisions that COBRA has arrived at today. The COBRA meeting has just concluded, chaired by the Prime Minister and attended by the Scottish Government, the First Minister of Wales and the First Minister and Deputy First Minister of Northern Ireland as well. The decision has been taken that we have now moved from a contain phase into the delay phase, where the objective is to seek to slow down the spread of the virus, to reduce the numbers who will be infected at the peak, the numbers infected at any one time. That is clearly important in terms of trying to alleviate the pressure at any one time that is placed on our National Health Service. And another key focus of that, and indeed later phases of our response to this virus, will be to protect those groups in society that the early data tells us are more at risk of developing serious illness. I should reiterate that the vast majority of people who get this infection will suffer mild symptoms that they will recover from quickly, but we know that there are groups, the elderly population and those with other health conditions, that are more at risk of developing serious illness, and therefore much of our focus in the weeks to come will be on measures to protect people in those groups. And what I'm about to say today, of course, there will be further actions that all 4 nations do announce in weeks to come as well. That shift from contain to delay clearly has implications. The initial implication of that is a change in the advice that we are now giving to the general public. The advice that we will be giving now is that from tomorrow, if you have symptoms that are indicative of having coronavirus, you should stay at home, you should self-isolate for a period of 7 days. And let me be clear what I mean when I talk about symptoms. That is specifically, and the Chief Medical Officer can expand on this later, that is specifically a fever or a persistent cough. I also want to be very clear that unless your symptoms don't clear up within a few days, or if you feel they are deteriorating, you do not have to call your GP or NHS 24. You should simply stay at home on the basis of the symptoms that are indicative of possible coronavirus. We will not be routinely testing everyone who has symptoms and is self-isolating. Clearly, the reasons for that are obvious, but I want to be clear that we will continue to do surveillance and sample testing so that we continue to develop the knowledge that we have around the spread of this disease. So the Chief Medical Officer can say more about this when we get into questions, but that is the significant new advice that will be given by all 4 nations across the UK to the general public, and that is the initial step that is signified by the move from contain to delay. There's a couple of other matters I want to address. Firstly, we will also be giving advice to local authorities and schools that we are now advising that overseas school trips should not be going ahead. I understand that the Foreign Commonwealth Office will be issuing travel advice that aligns with that position. I want to just address briefly the issue of school closures more generally. It is not the advice right now that schools should close, or indeed that colleges or universities require to close. That is not what we are advising at this stage, although that is an issue that will be kept under very close, ongoing, regular review. Maybe it would be helpful if I just expand on that point a little bit to give some of the rationale that, of course, is informed and guided by the scientific advice that we have access to. A couple of practical issues. Obviously, closing schools has a very direct effect on the ability to keep key workers at work. There is also a view that closing schools will lead to children gathering in more informal settings, which actually may be more of a risk of them contracting the infection, because unlike in schools where the hand hygiene protocols can be followed, that would not be the case. But there's also a point about longevity of a position around school closures. If it gets to the stage where the advice is to close schools, this will not be for a week or 2 weeks. This would be something that was advised to last throughout the peak of this infection, and that is potentially until the summer period. So this would be something that was not brief, and therefore it underlines the importance of having a position. If this position becomes necessary to advise, then we don't do that earlier than the science is advising us to do. And I hope that gives people some understanding of that position. These are, as I've said before, not easy judgments. They are difficult and complex judgments. That's why they've got to be kept under review, informed by the best science and the wider issues that we require to take account of. The last point I want to address is the issue of mass gatherings, and I should say at this stage that I'm articulating a Scottish Government position, not a UK-wide position. Other administrations, of course, will set out their own positions. As I said at First Minister's questions earlier on, we have looked carefully at this situation and come to the decision today in the Scottish Government that we will, from the start of next week, advise the cancellation of mass gatherings of over 500 people that have the potential to have an impact on our frontline emergency services. Now, I want to be clear, as I was in Parliament earlier on, that this is not a move that we are making because the science has told us that it will have a significant impact on the spread of the virus. On the contrary, the scientists tell us that it will not have a significant impact on the spread of the virus, although not a significant impact does not necessarily equate to no impact at all. But there are wider reasons that I consider and have judged that are important in reaching this decision. Firstly, there is the issue of consistency of public messaging at a time like this. If we are advising people, as we are now, that they, in the circumstances that I have already set out, should stay at home, and if, as I anticipate, over the coming weeks we will be advising people in other ways that their normal day-to-day lives have to change, then I think it is inconsistent to have a business-as-usual message around large gatherings. But the more important point is the one I articulated in Parliament earlier on. Certain events, whether or not they need dedicated ambulance cover, we know that certain events have an impact on our policing and frontline health services, accident and emergency and ambulance services. And at a time when the pressure on those services is going to be considerable, our public services, like all areas of our economy, will have higher absence rates because of illness. Our health services in particular will be under acute pressure in the weeks and months to come. I think it is incumbent on government to do what we can to remove unnecessary burdens on our public services, and that's the rationale for the decision that I am announcing today. There will be a number of questions. I'm sure you will have a number of questions, and other organisations will have a number of questions about the specific applications of this and which events it applies to and which events it might not. We will provide detailed advice over the course of the weekend before Monday to make clear exactly the scope of this and the reasons and the rationale behind it. But we are entering a period where there will be significant changes to people's day-to-day experience. That is going to affect all of us, and the difficult judgments that are involved in that have to be taken, and our responsibility is to do that in a way that protects as far as possible our ability as a society to deal with the impact of what we are going to be facing. The final point I want to make before opening to questions is to remind people that a virus like this simply cannot be made to go away, much as we would like that to be the case. The responsibility we have is to seek to manage this as best we can. We are going to face, and our health service in particular is going to face, a significant challenge in the weeks and possibly months to come, which is why our wider planning around NHS capacity is so important. But our focus is very much on seeking to delay the spread, to reduce the peak impact, and to protect the most vulnerable. And those are the guiding principles that will continue to inform the approach that we are taking. I know this is an anxious time for the public, and the Scottish Government, I as First Minister, the Health Secretary, the Chief Medical Officer and others will continue to do everything we can to make sure that there is clear, transparent advice and information for people, but this is not an ordinary situation, and I know the wider public understand that. So I think with those comments, I'm happy to take questions, and I'll call in the Chief Medical Officer and the Cabinet Secretary where appropriate. Jim.
First Minister, given everything you've just said about consistency of message and so on, and I know final decisions are still to be made, you'll announce that over the weekend, I suppose people are asking about gatherings of more than 500 people, football season, rugby season, sporting fixtures, church gatherings, etc. Can you talk to us about what kind of gatherings you are looking at with a view to cancellation?
What I've said already, and we will put more definition on this because people do have practical questions, but it's a kind of gatherings that potentially have an impact on our emergency services. So I wouldn't routinely describe a church gathering in that way, but a football match or a rugby match absolutely does. And that does sometimes will be because of the size. They may need dedicated ambulance services, but even smaller than that, we know that these kind of events can put a pressure on police, ambulance services and accident and emergency services. Now, we are not right now, but progressively over the next few weeks going to have a situation where those services are under acute pressure. I feel an obligation as First Minister, and there will be further things we have to do as we progress into this. I feel an obligation to remove as many unnecessary burdens on these workers right now as I can, and that's the thinking behind this. And as I say, we will set out more of the detailed definition, but that principle I've enunciated there should give people a sense of the kind of events we're speaking about. Colin.
Are you taking a slightly different approach to mass gatherings than the rest of the UK, and why are you waiting till Monday?
On that, this is a Scottish Government decision. I will let other administrations make their own decisions, and I'm making no criticism or judgment on the decisions that other administrations will take. But I have an obligation when it comes to particularly pressures on our public services and the resilience of our public services, as we all do, to make the decisions that I judge to be right. In terms of waiting till Monday, this is a decision that is about resilience and pressure on public services, as opposed to necessarily being driven by reducing the spread of the virus. We don't have to take it immediately, and that couple of days gives us the opportunity to do what I've just said to Jim, is make sure that we've got the guidance in place and the answers to the questions that people will have. Events over the weekend will also have policing shifts already allocated to them, so the practical effect of doing it earlier than that would probably be quite minimal in that respect. Yes, Peter.
First Minister, has there been any tension between the decision-making in this process? For example, we're going to hear from Boris this afternoon. There's a suggestion that they are not actually willing to take this step yet, and they think that maybe you've gone too quickly.
Look, you know, I don't think there's tension. I certainly don't feel tension. I feel a responsibility, firstly, to work well with the other UK nations, and I think we are doing that, and that's credit to everybody. There's no sense of political issues getting in the way of this. But health and public services and resilience are devolved matters, and I feel a responsibility to make sure I'm doing the things that I judge are appropriate. It may not be too long in the future before I or the Health Secretary are standing here saying that we have to take difficult decisions in our National Health Service to postpone non-urgent elective treatment to free up capacity to deal with coronavirus. If there are other things that are not necessary, like large gatherings that are also taking up capacity of people who work in our health service, I think that would be the wrong thing. So I'm taking this judgment. I don't know what other leaders in other UK nations will take. I am making no criticism of them at all. We all have a responsibility to take the decisions. And there will be most of these things will be consistent across the UK, but because of the devolved responsibilities, there will be, and this is one, there may be others where we do reach slightly different judgments on things, and I think it's important that we have that flexibility. Chris?
First Minister, you said the suggestion that schools could be closed for months ultimately if that decision was taken. Is that a UK-wide advice or policy? And what kind of strain would this put on the health service? Because then thousands of health workers would have to be off work looking after their children.
So the advice on schools that we're not advising the closure of schools right now, yes, is a UK-wide one. I understand, and this is not a criticism of you because I said what I said and stand by that, but I'm appealing, I guess, to all of you to understand the nuances as well of what I'm saying. I'm not standing here saying schools will be closed for months, so I am not saying that. I'm saying that in a situation like this, if you get to a position where you think school closures are necessary to help deal with it, that is not necessarily a very short-term thing, because the curve of this virus will be over a number of weeks, perhaps 2 to 3 months or more. So we've got to understand the implications of some of these decisions in terms of the timescales involved. Now, I think what that means is that we do not rush into decisions like that, given, as you say, the implications that that would have for our health service and keeping key workers at work. And what I'm trying to do here, as openly as I can, is share some of the complexities around the decision-making here. We're being driven very much by science. Our scientists, our chief medical officers are doing an absolutely sterling job right now, but politicians, ministers have to apply judgment to these things as well, and that's what we're seeking to do in as rational a way as possible. Keenan. Yeah.
What is your assessment of current intensive care beds capacity and what may be required in the short and medium term?
So right now in Scotland, we are working on plans to double intensive care capacity. We have between 200 and 300 intensive care beds right now. We've got more beds in addition to that for high dependency capacity, but we're working on a plan to double intensive care, and those plans, which the Health Secretary can speak to in a bit more detail, are underway. We're also working on plans to expand general hospital capacity, and again, those are underway, and also to expand the capacity to care for people in the community. I was visiting Wester Hailes Health Centre yesterday, looking at the expansion of the Near Me facility, which is enabling people to consult their GPs from their own homes. We're accelerating that as part of the coronavirus response. So all of that work is underway. I want to say very clearly that even with all of the things we are going to do to try to manage the peak of this, the pressure on our health service is going to be considerable. And that's why this wider planning is so important. Jean, do you want to supplement that?
Thank you, First Minister. Our plans are underway to double the intensive care capacity and to increase the bed availability in our hospital settings. The detail of how we will achieve that, with the Parliament's agreement, intend to make a further statement on Tuesday, and in that statement I will provide more detail about the specific steps we will take in order to manage down uncritical care, but also and retain the care that is necessary, that is critical to people's lives, but create the additional capacity we need to manage the instances that will come as a result of this virus. And we are also in daily conversations with our partners in COSLA about how we work together to ensure that we can increase and maintain social care in our communities.
James.
First Minister, the World Health Organization's advice in terms of what they call social distancing is and I quote, to maintain at least 1 metre distance between yourself and anyone who is coughing or sneezing to try to prevent the spread of this virus. Can you explain, in that context, why it is appropriate for 50,000 people to go to a football match this weekend?
Look, the scientific advice that I have, and I'll allow Catherine to say a bit more about this, is that cancelling big gatherings like that don't actually have a significant impact on reducing the spread of the virus. That's the clear advice I have. The decision around football matches, and I'm not referring to any particular match, this is a decision that has been taken and guided in general, and I am not particularly skewed or influenced by a particular event or football match. But the reason for this decision is, as I've set out, it is around the consistency of public messaging and the resilience. But we are following on these issues the scientific advice that we have, and Catherine might want to expand upon that.
The decision today to advise people with symptoms that may be suggestive of coronavirus, so a cough or a fever, to stay at home for 7 days is exactly following that WHO advice. We don't want people who may have coronavirus to infect those around them. So they're self-isolating at home for 7 days. Obviously, this is likely to be mild, as we've said. You wouldn't phone your GP or the NHS out of hours service if you had a cold. But what we would say to people, if you don't get better, your symptoms deteriorate, or of course for any other symptoms, just act as you would have previously.
But sorry,
No, hold on,
James,
James.
just to be
No,
clear,
hold on.
Social distancing I was asking about.
Yeah, but
Are
let
we
me
wrong about that?
let me complete that point. Well, Catherine, you complete the point, and then I will come back afterwards. Sorry.
So this is social distancing. This is asking people with symptoms who may, because the symptoms are what is infectious to others, to stay away. So that is to stop spread in the population more generally, but also to protect our most vulnerable groups. We're starting with this measure. This is a social distancing measure. We will have other measures, and as we are advised, we may bring in further social distancing measures as the spread of this disease progresses in our population and as we are advised by the science.
So, can I be clear? I know and I understand why there is a lot of interest in the mass gatherings position. The most important thing we are talking about here today is the advice to people who have symptoms indicative of coronavirus to stay at home from tomorrow. So to put it bluntly, James, if you have a fever or a persistent cough that is indicative of coronavirus, you should not be at a football match on Sunday or any of the coming days. That's the social distancing that is consistent with the WHO advice. Yes?
This morning, Alistair Jack said that elderly people and vulnerable people should do as much as they possibly can to, I think his phrase was, be as contained as you possibly can to elderly and vulnerable people to try and stop them from catching this. Is that, do you agree with that?
I didn't hear Alistair Jack this morning, but we've just participated in the Cobra meeting discussing these things. So what I'm saying to you is there may be, there is very likely to be further advice in the days or weeks to come around elderly people and what we are suggesting they do. But the advice we're giving today is the advice we're giving today. And if there is further advice for elderly people in future, then we will set that out clearly at the time. Do you want to add anything to that?
And these measures are brought in for effectiveness at this stage of the level of transmission in this country. If we bring in measures too early, we are advising these sort of things potentially for weeks to months. That would have a very significant impact on our elderly population, risks other impacts, and actually we don't want to do it too early because in fact it's not going to be effective at this stage in the disease, but it will be more effective. We're looking for maximum impact and the least downsides on our population, and we're going to be asking them potentially to come with us on this, to comply with some of these measures for a long period of time. So similarly with the schools, you don't want to start doing these measures too early because they may need to continue for many months.
Okay, I'm going to take a couple more questions because the Health Secretary in particular has to get back to Parliament. So, yes, Lorna.
I'm just wondering what your message would be, say, to the person who has COPD, the person undergoing chemotherapy, the elderly person living at home who maybe looks at Italy, sees doctors talking about a bomb going off, who are scared, who are worried. Yeah. What would you say to them?
Well, we will, I'm going to very quickly hand over to Chief Medical Officer on this. For people who have already severely compromised immune systems. There is standing guidance in place that they will be adhering to and should be adhering to and will have had advice on. The Chief Medical Officers are working on advice that I hope will be available reasonably soon on people with other conditions, but at that point I think I will hand over to the Chief Medical Officer.
We want to make sure we give people the right advice according to their condition and also according to the level of social distancing we would be asking them. For some people, perhaps that will be staying really quite self-contained in your home, again, for many months. We don't want to give the wrong advice or inaccurate advice to the wrong groups of people. So we are working on a very long, complex list of different conditions. We're working on what would be the best advice to protect them. We will have that advice in the coming days. So people, as the First Minister has said, who already know have a weak immune system, such as those currently receiving chemotherapy, they already know what to do to avoid their risks of infection, and they should continue to follow those measures. For those other conditions, we will have a stepped approach. Some people are more at risk than others, and we will give advice in the coming days.
But what, First Minister, can you say to reassure those who are scared?
The thing I would say to reassure people is that we are taking all of the appropriate steps advised by the medical and the scientific experts that are about protecting those most at risk and about reducing the overall peak of this infection. And, you know, I think people should take some trust in the fact that this is an informed, well thought through approach that we will continue to keep under review, and that we will give proper, accurate, detailed advice to different groups in society so that they know what they're going to do. But this is a situation that is going to prevail for potentially a significant number of weeks. We need to make sure that advice is accurate and right, and we need to make sure it is given to people at the stage where, when we're asking them to change their behaviour, they're doing that at the right time in order to give themselves adequate protection. Yes.
The Republic of Ireland has already closed schools. Do you understand why they've done that, and why is the advice different in Scotland? And also, GPs normally get a long weekend for Easter. Will leave be cancelled this year?
Look, on the GP issue, of course, we'll liaise with health professionals, with the GP workforce around those kind of decisions, and I think it's right that we have those conversations with them first of all. On the situation with the Republic of Ireland, I'm not going to second guess the decisions that other leaders in other countries are making. We all have incredibly difficult decisions to make. I am not privy to the scientific advice that the Taoiseach will have had, but I am absolutely sure that he will have taken decisions based on his best judgment and advice, just as I am seeking to take decisions based on my best judgment and advice. And I've set out the reasons for the decision that we have reached at this stage around schools, but repeat again that is a decision that will remain under review. And Tom.
Another question for the CMO. When we are at peak, will you have to give people of different ages different treatments? I understand, for example, that people under 65 may be prioritised for respiratory care because brutally they have the best chance of survival.
This is an evolving and emerging situation. You've already seen it changing from day to day. We were in containment phase. We're now in delay phase. One day we're giving different advice to people to try to reduce that peak of transmission. We will be taking decisions already based on the possibility of more capacity being needed in the NHS. We will talk, as the First Minister has mentioned, about our timing of stopping elective surgery in order to free up hospital beds, in order to free up our intensive care beds. Those plans are already in train. So we are responding as this disease emerges, and we will, as we are going to have to over and over again, need to make difficult decisions. These are difficult decisions we're discussing today. These are talking to people about changing their habits, and potentially in the coming weeks, many people changing their behaviours, behaving differently, not being at their work. And I think that as we progress, more difficult decisions will need to be taken within our NHS.
Tom, we're not going to have. I'm not going to allow words to be put in our mouth. We will take these decisions, and we will.
This is being looked at by some NHS boards already.
We will communicate these decisions as and when we take them. Our focus right now, and I'm not trying to dodge this question, but it's important that we understand this. Our focus right now is to do two things: to reduce the demand at peak as much as possible, and to increase capacity in the NHS as much as possible. Where both of these things take us is an evolving situation. It will involve difficult decisions along the way, and we will be as transparent as possible. But I really don't think it helps anybody for us to rush into kind of soundbite answers to things like that are not helpful at this stage. We will continue to try to inform you so that you can inform the general public in a proper and rational way as we progress through this. Right, sorry, I promised Alison, and then I'm going to have to call it short in a second. So, yes.
With the cancelling of mass gatherings, for people out there, it's not simply, you know, they're not getting to a concert next week, they're not getting to a football game in a couple of weekends. This could be a way of life for months, potentially.
This is something that's going to be with us for a considerable period of time. And one of the things that we have to understand is that in a virus situation like this, as you flatten the curve, which we are trying to do, you also potentially elongate the curve. Now, that is what we are trying to do for good and right reasons. So part of the reason that we are being so considered in these decisions is because we recognise this is not necessarily asking people to do things for a week or 2 weeks. That's why we've got to get it right. The public have to have trust in what we're saying, because compliance with these measures, for them to be effective, is important. And that's why building understanding, building that trust, and so that people understand that if we're asking them to change behaviour, we're asking them to do it for good reasons and at the right time, so that even if it is for a longer period of time, it is not longer than is absolutely necessary. And okay, I'll take Tom. Did you have a question? Can I take Tom? I'll come back to you, and then I'm going to cut it short.
Did you sense any frustration from Boris Johnson and the UK government that Scotland has gone this different way in terms of the mass events, and there's no longer a unified approach?
Look, you have to ask him that. I certainly don't think that should be the case. I have a responsibility to take decisions within my areas of responsibility here. He does likewise. He may do things in the management of this that we decide not to do, and I respect that. I think on the vast majority of this, and what we've announced today in terms of the broad approach to this, is absolutely consistent across the four nations. But there will be aspects where we decide to do things differently. There are differences between countries, and we've talked about the Republic of Ireland and the differences there from here. We all have to apply our best judgment to this, and that is what I am seeking to do. And Chris, finally.
Yeah, just Chief Medical Officer, are you content for this weekend's football matches to go ahead, including the Old Firm? There's been some questions about why the Monday cut-off mass gatherings.
The Prime Minister has taken advice from me all the way through this. We know that mass gatherings and stopping those are not the best way to contain this virus. We know that they have perhaps some impact, certainly not no impact. This weekend, the level of virus in Scotland, although we're moving to the delay phase, the level will be still that the risks to individuals going to that football match are still relatively low. The more important point is that the effective ways of reducing transmission across this country, flattening that peak, are that if people with symptoms, which might be coronavirus, stay at home and don't risk infecting other people. And that includes football fans going to matches at the weekend.
Yeah, and that's the key point. If you have symptoms indicative of coronavirus, you should not be at the football match at the weekend. Right, can I thank you all very much? I know there's always lots more questions in this. We will seek to be as accessible as possible as we try to answer these questions in the weeks ahead. So thank you for your time just now.